So what happens when we get a referral from the lab, we send out an appointment. And the appointment depends, again, if it's mildly abnormal, that can be within 8 weeks. If it's severely abnormal, it can be within 4 weeks. If it's query invasion, it's within 2 weeks. So we see the patient within between 2 and 8 weeks, depending on how abnormal the smear is. Colposcopy is essentially examining the cervix under something that magnifies the view up. So when someone's having a colposcopy, they have a speculum inside the vagina, the same instrument they have when they're having a smear taken. But I, as the colposcopist, am looking through binocular vision instrument, which gives me a times, somewhere between a ×6 to a ×18 view of the cervix. So your normal cervix is that size, well, smaller, even smaller than that. I'm getting this sort of view. Okay, so again, this is sort of magnified up. But of course, that's what I'm seeing, but of course what the cervix is a cylinder with a canal up into the uterus. Okay? Feel like, what's his name?
Jonathan Miller?
Draws all
oh,
this.
yes. Rolf Harris.
Rolf Harris, that's
yes.
it. Anyway, so when I'm doing a colposcopy, I'm looking at this because these abnormal cells always occur in this sort of area, which is called the transformation zone, or TZ. The abnormal cells will, well, not always, but usually occur in this area. So we get a ×6 view, and we then put some dye on the cervix, and the dye is actually acetic acid. Acetic acid, what's the common?
Vinegar.
Vinegar, but it's 5% vinegar, so it's very, very weak vinegar type solution. And what acetic acid does is it attaches it attaches chemically to the cells, the abnormal cells on the cervix, and makes them go white. So when we do a colposcopy, if there might be a little area here that goes white, and that would suggest to me that there's an area of abnormal cells there. If the smear is mild or borderline, then we sometimes just take a little tiny biopsy of this area, what we call a punch biopsy. And that's taken without any anaesthetic or anything. The patient doesn't tend to even feel it being taken. And that gets sent off, and again, similar to the smear looked at under a microscope. If the biopsy confirms abnormal cells, then we sometimes offer treatment, which I'll come on to. If they're moderate or severely abnormal cells, then again, we sometimes will just take a biopsy, and especially in younger women. But what we will sometimes do in older women, or women who are sterilised or completed their family, is offer them what we call see and treat, which basically means we do the treatment at the first visit. And what we do is we actually remove this abnormal area with a loop. So a loop is a little piece of wire with very weak electric current running through it, and it cuts through tissue. So we put some local anaesthetic into the cervix with a very fine needle, and then we used a little wire loop, which is really just this sort of shape, and we used that to essentially scoop away the abnormal area. So again, in the three-dimensional picture, this abnormal area here, we take out a scoop of tissue like that, and this all gets sent again to the lab, and that tells us whether we've removed the abnormal cells or not. So that's the treatment for moderate or severely abnormal cells, and say we sometimes offer that on the first visit. If they're mild or borderline and the cells come back as mild, then we could offer people conservative management, which basically means we offer them just another smear in 6 months' time, because up to a third of mildly abnormal cells will go back to normal without any treatment whatsoever. If they persist for up to 2 years, then we tend to offer treatment, and the treatment for mildly abnormal cells is we put a little probe on the cervix that heats up to 130 degrees centigrade for 30 seconds, again with some local anaesthetic first, and that destroys hopefully the mildly abnormal cells. If the biopsies are telling us that we've removed all the abnormal cells, then, or after we've done this sort of treatment for mildly abnormal cells, we just see people back in 6 months and do a smear, and in about 96% of cases the smear's gone back to being negative. After the first follow-up smear, we then discharge back to the GP for further follow-up smears. When you've had treatment, you are slightly more likely to have further abnormal smears. So even with treatment, you need to have closer follow-up. So again, the cervical screening program advises yearly smears for a number of years, and the screening program, the computer system should know when you've had your last smear, when your next smear is due, and obviously each report tells the GP or the practice nurse when to do the next smear.
Can I ask a question?
Yeah.
If you have a moderately or severely abnormal smear, does that mean it's precancerous? I mean, does that mean if it was left alone it would become cancerous?
All these changes are pre-cancer. Even severely abnormal smears, only about 10 to 20% left untreated for maybe 5 or 10 years would develop into cancer. And this is all to do with human papillomavirus and whether it has been cleared or not. Also smoking, etc. But no, not all abnormal smears and cells will eventually turn into cancer. The problem is, at this stage, we don't know which person will develop cancer and which won't. So we have to work on the basis that we always remove the abnormal cells, get the smear back to normal, and then the patient's less likely to develop cancer.
If you have the loop treatment, are you more likely to have a miscarriage in future pregnancies?
After a single loop biopsy, no. After repeated two or more loop biopsies, and there's only, most people we can only do 2 or 3. It doesn't, after 2 there is an association with premature delivery. A small association with premature